Hi, and welcome to Counter by Colette. Today I want to talk about men. I want to talk about how important testosterone is to men, but just as equally important as testosterone is, so is estradiol. It is not just a female hormone. So too often I see my men coming from TRT clinics. They get the cookie cutter approach. You walk in, you get 1 cc of testosterone, you get 1 milligram of aromatase inhibitor, oftentimes Arimidex, and 250 micrograms of HCG, and then have a nice life. So when they come to me, I see estradiols less than 5. So not only do I not just do a total estrogen level on them, I do the ultra sensitive estradiol. So I can actually get a clear picture of what the true estradiol is. As much as estradiol protects our bones, our brains, our hearts in women, so does it in men. So estradiol is a very critical vasodilator. So it is really imperative for men because their risk of heart disease surpasses women most of their life. Women catch up if they don't do hormone replacement in their 50s. So if you start seeing estradiols less than 20, you're going to see the impact. So number one, cardiovascular. Estradiol raises your HDL. It lowers your LP(a). There is not many things that do that. That is a genetic predisposition for heart disease if you have a high LP(a). Estradiol can lower it. ApoB, here's another more sensitive marker than your LDL-C. And estradiol can come in and lower that. It's a nitric oxide, so it's a vasodilator for all of your endothelial function. So it's so critical for your heart. You do not want to be estradiol deficient. Bone health. If you do not have enough estradiol, we see this in men that have prostate cancer, where they're practically castrated. They have no testosterone. We see an increase in osteoporosis. So we want to protect our bones. Men can get hip fractures too, and that increases your death rate by 1/3. Once you have a hip fracture and you go through surgery, it's recovering from surgery, and that sedentary lifestyle tends to lead to all these other comorbidities. Body composition. Believe it or not, estradiol is very critical in reducing visceral fat. Visceral fat is non-metabolic. It leads to all the other syndrome X comorbidities that we are seeing in heart disease. What about mood? All right, it decreases that depressive symptomology that you see. You think more clearly. You're better cognition when you have enough estradiol. But most importantly, in my men, is if your estradiol is too low, you obviously there's not as much nitric oxide, and you have difficulties having erections. That alone would be like, and your libido suffers. So you're you're so scared of estrogen, and you're thinking, oh my God, it's a female hormone, I don't want any estrogen, but actually you do. So in the next few talks I have after I gave you my little intro, you've got Dr. Wing, who I think is amazing. I don't know, I watch his stuff all the time, Man Medicine. He talks about how he himself is actually using estradiol, not in this particular segment that I provided in this video, but he is actually, there's a video where he does talk about how he injects estradiol because he does have a high LP(a) and he wants to lower it. Then my very well-respected colleagues, Jay Campbell and Hunter Williams, they talk openly how they have used injectable estradiol to improve libido, performance, joints. It goes on and on. And finally, Dr. Louise Newson, who is an incredible internal medicine doctor who is specialties in hormone replacement. She talks about the benefits of estradiol in men. So enjoy, take a listen, and if you're one of these guys out there thinking that being on aromatase inhibitor is where it's at, I really want your doctor to be running an ultra-sensitive estradiol, and unless you're having gynecomastia symptoms, where you have sensitivity in the nipple region, some people are predisposed. I say look for a good surgeon before you start going on aromatase inhibitor. The consequences of going on a aromatase inhibitor are too great. Or you just, you really become more effective negatively to too high of estradiol, because there is a turn where if the estradiol does go too high, then you offset the balance. Then you have to ask yourself, how are you taking your HRT? Maybe we should reevaluate that. And I'm not here to talk about how you're using other steroids. I'm talking about doing things as a man that you can do for the long term. some things in performance enhancing lifestyle isn't sustainable. I'm talking about sustainability. And being an aromatase inhibitor to me is really not a sustainable way to live your life. There are too many consequences to knocking your estrogen down to less than 5. Enjoy.
Women, premenopausal women tend to have lower lipoprotein A levels until they hit menopause, and then their levels go up, similar to the men. And that's presumed to be related to their elevated estradiol levels. So this is a study, hormonal regulation of serum lipoprotein A levels. It's in the Journal of Clinical Investigation. So what they did is they took elderly men with metastatic prostate cancer, and they randomized them to either have orchiectomy, so they were castrated, or to receive oral plus or minus intramuscular estradiol, and with the goal of like lowering their testosterone levels as low as possible, and basically seeing what would happen to their lipid panel, specifically their lipoprotein A. The men that were given estradiol, either orally or intramuscularly, they had about a 50% drop in their lipoprotein A levels on average. The men who just were castrated and didn't get anything, both groups dropped their testosterone significantly, but obviously the castrated group also had a drop in their estrogen levels because estrogen comes from testosterone. Well, they had a 20% increase in their lipoprotein A levels. So it's pretty clear, obviously in women, estradiol is beneficial for lipoprotein A, but according to this study and a number of other ones that I did not include in here, estradiol has a positive effect in terms of lipoprotein A in men as well. So what does that mean for you guys on TRT? It means, for God's sakes, don't take anastrozole. Do not block the conversion of testosterone to estradiol. There's so many other reasons not to do that, but this is just one more. If you have a high lipoprotein A level, you can expect your lipoprotein A level to probably increase if you start blocking estradiol. So yet another reason not to do it.
These stupid masking drugs that bodybuilders and performance athletes use, like SERMs and AIs, yes, all of these, they're terrible. They're toxic. Women's breast cancer drugs, should never use them. Yes, you can mask the presentation of gyno if you have the gene by using those drugs, but as you know, it's not solving it. It's important that people know that the only procedure is surgically removed, which most men today who have been using therapeutic testosterone for a long time, what we call either testosterone or estrogen resistance syndrome. And so now what's happening is men can't absorb testosterone or estrogen at the tissue level like they could 20 or 30 years ago when we didn't have all this toxic siege, are experimenting as men with very, very low microdoses of estrogen for sexual function, for brain function, health, for better bone mineral density, better skin. Hunter and I have been using 1 milligram of estrogen injected, and this is, by the way, estradiol cypionate, but better heart, better erections. I mean, insane erections, better just well-being. I mean, it's instant.
Testosterone in men is a reservoir of estradiol, and most of the beneficial effects of testosterone in men, apart from muscle mass, are mediated via estradiol, via its conversion to estradiol, including erection and libido.
Yeah. So we should be doing more studies in men about the importance of estradiol in the metabolism and longevity and mitochondrial function of men, because men get really freaked out when I say to them that they've got more estradiol in their body often than menopausal women who don't take hormones.
I see a lot of men who come when I put them on testosterone and tell me, oh, doctor, I have a high level of the female hormone. I have to explain to them it's not a female hormone. And I also see men who come treated by some outside doctors in women's health clinic who put them on testosterone with an aromatase inhibitor. Basically, they eliminate all the beneficial effects on testosterone, especially on vessels, because men with aromatase mutation who do not make estradiol, they die of a heart attack soon. Not only they have osteoporosis, but they die of a heart attack. So I have to explain to them, listen, it's not a female hormone. Without estradiol, you wouldn't have a hard-on. I tell them exactly like this. They never ask me the question again. One thing is the effect on mitochondria.
Yeah.
If you improve mitochondria, the powerhouse of the cell, you improve metabolism, and you prevent metabolic dysfunction. So I think it's the most important thing. Then there is, like you said, a very important effect on the immune system and the prevention of inflammation. And then if I had to choose a third one, I think it would be the brain cognition. But there are lots of other effects because basically estradiol works on every single organ and cell.